All right, so we're gonna try to do a narration over the cadaver video. So if the animation is a little bit off from my narration, it's because I'm overdubbing right now. If you do not have your trail guide or your muscle worksheets out, please pause this video, go get them because you're gonna want them as we move through the video. So we're gonna start basically in the anterior side and just move our way through here. So we're gonna start with Sartorius, longest muscle in the body. You can see it highlighted. That wonderful S curve as it moves all the way down, crosses the knee joint, goes down into the pes anterior. So this is our first of our sergeant muscles. This is the S in sergeant. And I'm just basically going to go, and now I'm going to remove Sartorius just to expose the rest of our anterior musculature. So that starts with the quadriceps, and our longest quadricep being the rectus femoris, the only one of the four that cross both the hip and the knee joints. So we're going to remove that. Now we have the vastus lateralis, and I'm going to rotate the vastus lateralis so you can sort of appreciate that it inserts into the linea aspera, which is actually on the posterior side of the femur. So it almost wraps around and kind of tacos the femur as it comes around to the anterior side, inserts into the patella down to the tibia tuberosity. And we're going to get a similar relationship on the medial side with vastus medialis. And you can almost really appreciate from this view, not this one, but this view, how he does have that wraparound as it wraps to the linea aspera. So we're going to remove that, and that just leaves us with our vastus intermedius, the deepest of the quadricep muscles. Really can't palpate it because rectus femoris is on top of it. And we are going to now, once we remove that, basically expose the femur and gone. So there's anterior musculature has been exposed. That little strap right there, that is the infamous genu articularis. Some textbooks may consider a quadriceps. I do not. Google it though, and you can find out everything that the genu articularis does. So we're going to get rid of that little guy in a second. And now we are going to move our cadaver onto a sideline position. And now we're going to look at the lateral musculature. And obviously the biggest one on the lateral side, the biggest structure is going to be that iliotibial band, that very tight band of tissue. We palpated perpendicular to the fibers in class the other day. It's going to come all the way down. It's going to cross the knee joint. And it really is coming from that tensor fasciae lata, which you can see in red here is really small. It's not that big of a muscle relative to the rest of the musculature we've been talking about, but it's going to come down and insert into Gerdy's tubercle past the knee joint. I want you to take a minute. I know I eliminated it or I dissected it away, but I want you to appreciate that Gluteus Maximus, which is highlighted here, does actually have a relationship with the iliotibial band. So even though I removed the iliotibial band, please appreciate that Gluteus Maximus still has a relationship with it. So that's Gluteus medius, iliac crest coming down to the greater trochanter of the femur. And then deep to it, once we remove Gluteus medius, is we have Gluteus Minimus. Same idea. It's deep, iliac crest, iliac fossa, going to the greater trochanter of the femur. So we are going to now get rid of that. And our lateral musculature has now basically been dissected away. And so we're going to continue rotating the cadaver into a prone position to get to the posterior musculature. You can't talk about the posterior musculature without talking about Gluteus Maximus, appreciating the fibers go in that sort of oblique direction. Very large muscle coming from the sacrum, going to the gluteal line in the femur. So we are now going to remove Gluteus Maximus and look at our other posterior musculature. Give me a second. Let me get rid of her. Again, it should have an IT band there, but that's already been dissected away. It's okay though. So we are now going to remove Gluteus Maximus, and that's going to leave us with our exposure of the external rotators for the first time, and our hamstrings, what we're going to tackle next. So our hamstrings have a common origin on the ischial tuberosity. Hi guys. So the first one we're going to look at is semi-tendinosis. You can appreciate semi-tendinosis actually has a very, very long tendon. Look how long that tendon is. It's enormously long. So we can appreciate that. And hold on, I'm going to make sure our video is still working. Semi-tendinosis is actually going to wrap around to the anterior side and insert into the pes anterior. Oops, sorry, I went too far. I'm going to rewind a little bit. There we go. Sorry for that, folks. So we're going to come back. Semi-tendinosis wraps around to pes anterior. There's biceps femoris, our only lateral hamstring muscle. Ischiotube coming to the fibula head. It crosses the knee joint also. So you have, I'm going to pause the video right here so you can really appreciate the semi-tendinosis is coming down. You can see it right here, and it's wrapping around. So you can see that's wrapping around to the anterior side. Biceps femoris is staying lateral the whole way. So appreciate that relationship. And as I continue to rotate the cadaver, make sure you're doing your mental gymnastics, see if you can pick up on that as we're going through. So there's a wraparound of biceps femoris and semi-tendinosis. You can also see biceps femoris has two heads, the short head and the long head. They come to conjoined tendon. We really don't deal too much in the short head because it's so deep. We really deal only with the long head from the ischiotube. So that just leaves our semimembranosus, which starts posterior and stays posterior. So it comes from ischiotube, comes on down, and inserts in that posterior tibia. It does not wrap around. So this is the only hamstring that actually starts posterior and ends posterior. So we're going to remove that. And now that exposes our adductors. And if you can appreciate here in the adductors, they actually have a very close relationship with your hamstrings. So as I continue to rotate the cadaver, I want you to take note that if you've ever had a person with a hamstring issue or an adductor issue, they've probably had the other also. So if you have a hamstring strain, you should be addressing the adductors. And if you have an adductor strain, you should be addressing the hamstrings. You can see our adductors have this origin way up high in the pubic bone and way up in the modesty area. So we're not going to worry about palpating these origins. As a matter of fact, I don't really think you really ever have a reason to palpate these origins. So the first one we're going to deal with is Gracilis, and we're going to deal with Gracilis because this is the third of our pes anterior. This is the G. So we can actually palpate this insertion point in the pes anterior and the anterior medial tibia. Again, we're not going to go for the origin because of its proximity, but we can at least get to the insertion. The next one is Adductor Magnus, very, very big muscle. You can see it here. I'm going to rotate it. And we've already done this insertion point. There's the adductor tubercle on the posterior superior femoral condyle. So we can palpate that. And I just circled in red for you. We can easily palpate the adductor tubercle. So we can palpate a portion of Adductor Magnus. As I continue to rotate the cadaver, you're going to see the adductor hiatus, that big opening right there. I believe I'm going to highlight that in a second. And you can see the other attachment point of the adductor magnus on the femur. So there's a hiatus. I just highlighted it for you. And the rest of the adductor magnus. So a very large, very powerful adductor muscle. Once we cut that away, that leaves us with adductor longus right there. Not as big as magnus, but certainly bigger than the one we're going to do next, which is adductor brevis. And that's still a little bit bigger than the next one we're going to do, and that's adductor minimus, which is the really small one. Don't deal a ton in adductor minimus. I actually don't even think a lot of textbooks acknowledge adductor minimus, but it's right there. There's adductor minimus. And that just leaves us with the last one, which would be pectineus. You can see how high and how proximal to the pelvis pectineus runs. So those are our adductors. So you can see we've really stripped down the femur both from an anterior, a medial, a lateral, and a posterior view. Now, I apologize here. I had a little bit of trouble with the cadaver table, and I accidentally removed all the musculature, so I'll bring them all back. And as I do that, I will start dissecting through because we have to get to the pinwheel or the external rotators. So the external rotators is a piriformis, gemellus superior, obturator internus, gemellus inferior, obturator externus, and the quadratus femoris. So as I continue to cut through, I'm going to pause it right here. Actually, no, we're still pretty good. And the mnemonic that the TAs came up with, I think Marilee came up with it, is people go inside and get oodles of queso. Queso spelled with a Q for the quadratus. So the go inside is for the obturator internus, the inside for internus, and the oodles, the E is for obturator externus. So you can see it is really a pinwheel. They all pinwheel off the greater trochanter of the femur, and they sort of make that splay or that pinwheel around the pelvis. So we're going to go through these one at a time and see if we can figure them out. The pinwheel, and again, this is our mnemonic, starts with the most superior muscle. So in our case, that would be the piriformis. Probably the easiest one to palpate. It has a very intimate relationship with the sciatic nerve. Then you have Gemellus superior, which, and then you have Obturator Internus, Gemellus inferior, which is going to be the next one we highlight. Give it a second. So piriformis, Gemellus, Obturator, Gemellus again, and then quadriceps femoris would be that large one down below. Again, I'm overdubbing the video. I don't remember exactly how I did the video. I'm going to pause the video right here because the one tendon we haven't mentioned yet is this guy right back there, that little tendon right there. That is actually the obturator externus. Okay, so we have piriformis, we have Gemellus superior, we have obturator internus, Gemellus inferior, obturator externus, and then we have quadratus femoris. And this video is going to get a little wonky, so I'm going to sort of explain this now because I'm going to go through a lot of really weird angles as I rotate the cadaver. But the internus and the externus is all in relation to the obturator foramen. So even though this is a posterior view, and even though you would think this would be the external view, what you need to realize is this obturator internus actually comes and actually loops around inside or goes internal to the obturator, whereas the externus, which is right here, it's deep to the quadratus femoris. It actually stays external to the obturator the whole time. So as I rotate, I want you to appreciate. So the internus, yes, it starts out here, but it loops around and goes internal, whereas the obturator, which you can't see because it's deep to the quadratus, stays external the whole time. It's a little confusing, but and especially when I start rotating the cadaver, I don't want you to get overly lost in it. So again, greater trochanter, piriformis, Gemellus superior, obturator internus, Gemellus inferior. I'm going to skip, and there's quadratus femoris. You can see I didn't highlight obturator externus on that one, but I probably should have in retrospect. All right, so the mnemonic, people go inside and get oodles of queso. So what I'm going to do now is try to show you the relationship of the obturators to the obturator foramen. I don't think I do a great job of it because you can see I still have all these adductor musculature, etc. So I'm hoping you can appreciate it. So there, I'm going to pause the video right there. And that line right here, that tendon, that is the obturator internus wrapping around from that posterior side. So it's wrapping around. So you can see it's actually internal to the pelvis, on the inside of the pelvis. Okay? So you can see it's right there. There's the fascia covering the hole. And so I'm really struggle trying to find a good angle for this. So this is a transverse slice of it. And again, I'm trying to find it. And I'm going to keep moving it around. So I'm going to get rid of this musculature. There's pectineus. There it is. Going to get rid of pectineus. I'm going to get rid of the rest of the adductors. There's Adductor Minimus. Woo, go away. There's pectineus again on the other side for some reason. So I'm trying to get rid of Adductor Longus. There it is. Get rid of that. Cut away. Magnus, go away. Brevis, go away. So you can see there's the fascia. And in this one, boom, you can see how it's highlighted. There's the tendon being highlighted. It's coming on the inside. So it's all in relationship to this bone right here, okay? Because that's what's basically forming the obturator foramen. So the muscle here is internus because it's inside the pelvic circle. It's inside the pelvic rim. And the muscle that's out here is obturator externus because it's outside of it. And so that's how that works. So the muscle that's running like this is actually external to it. It's a little confusing. I tried my best to show it to you, but I'm hoping you can pick up on it. So the pinwheel, though, is people go inside and get oodles of queso, piriformis, Gemellus superior, obturator internus, Gemellus inferior, obturator externus, and quadratus femoris. So again, I'm hoping this helps a little bit. I'm hoping seeing the musculature helps a little bit as you go through. I did want to make mention that I sort of forgot two muscles here, so I'm going to fast forward here, and I'm going to actually get to these two muscles, and that is the iliacus and the psoas major. These are our abdominal pelvic muscles. So you can see the first one I'm going to look at as I continue to eliminate the quadriceps, sartorius, bi, rectus, pectineus, get rid of them all. I'm just dissecting them away so we can actually get to it. So you have the iliacus, which is coming from the ilium. And it's going to dive much deeper and go to our lesser trochanter of the femur, which we really can't palpate because it's so medial and so deep. But you can see it's going right there from the ilium down to the lesser trochanter of the femur, circled right there. And you're going to notice a muscle right next to it. They come down to a conjoined tendon, and that's going to be from the psoas major. Long strappy muscle coming from the lumbar vertebrae. So as I rotate the cadaver the other way, come on. You can see the psoas major is coming from the lumbar vertebrae. It's basically joining with the iliacus, forming a conjoined tendon, both of them coming to the lesser trochanter. And they're both passing underneath the inguinal ligament, which I'm drawing right there in yellow. So as they pass deep with the femoral triangle, they go down into the deep musculature. So I'm hoping this video helped you. It is the anterior, the posterior, the medial, the lateral, the external rotators, the hip flexors, etc. of the upper leg. Again, if you need to watch this multiple times with your trail guide and your muscle worksheets, please do so. So I'm hoping this helped, and good luck.